One of the more polarizing issues in the United States is healthcare, and I've observed things that from the outside might appear bizarre or unusual. I like Americans to debate issues like healthcare more than they do, but I also require debate on the topic to be intelligent. On the left, you have the liberals, who tend to push for state healthcare. On the right, the conservatives, who tend with fully privatized healthcare. Neither side seems to actually understand healthcare. I figured that to understand the American healthcare industry, and healthcare in general, I'd start by talking to doctors and nurses, which I had ample time to do during my hospital stay back in 2011. And I've continued to do research on the topic largely by comparing international systems and speaking more to medical professionals here in the United States. What I've uncovered is issues that are never presented by either side, and it seems to me that asking a doctor what they think about something, unless the person asking is deliberately fishing for responses in favor of the position they already support, is seemingly an original thought that no one on the left or the right wants to have. From the issues and responses I have repeatedly observed, the image that has been painted for me tends to be in favor of universal health care. It seems to me that there could, given proper circumstance, be a functioning model of state health care, privatized health care, or a mix of the two. However, that does not imply that any of these three are in a position to practically come about in the present United States of America. I define a functioning model to be one that suits my goal for the medical industry. We should have the best doctors, we should have the best quality treatment for the largest number of people, and it should cost the least money. If we don't have that, or aren't advancing in that direction, then the model isn't functioning. If another country has more of its citizens getting higher quality health care than the United States does, and at less expense to the state, that would indicate our country has an inferior healthcare system that isn't the best in the world, and that's a problem. Both sides seem to believe they have a solution, but neither seem to have any interest in asking what a doctor thinks, unless it's to fish for support for their already pre-established agenda. It seems to me that the left is convinced state health care will heal America's medical problems, whereas the right seem to believe that maintaining its privatized status, or making it more privatized than it already is, will in turn solve America's medical problems, neither of which is inherently true. I'll start with criticizing the right, conservatives and privatized health care, then move on to criticizing the left. Note that these criticisms do not necessarily apply to all conservatives or liberals, simply the majority that I've met. It seems to me that most people claiming to support capitalism and calling themselves conservative have little to no sense of what the words mean. They like certain politicians for whatever reason, and they decide that capitalism works and what their politician of choice says is correct. People in this camp, I've noticed, are more likely to use words like socialist as an insult, and yet none are ever able to define socialism or capitalism when asked. I've noticed that a lot of people, when questioned about what they actually believe, are socialists, who at the same time say they hate socialism. But these are really just buzzwords because they don't bother to understand what capitalism or socialism are or how they function. Capitalism as a word is often imbued with magical properties and assumed to be able to solve problems simply by virtue of being. No one cares how capitalism will go about solving these problems or the inner workings of capitalism. It's just a magic word, akin to saying abracadabra. So here's a crash course for how it's actually supposed to work. The idea is that free markets and lack of regulation allow for more competition. More competition means that the various providers will be more competitive, making them make more efficient products at lower prices in order to stay in business and make the most money. This then produces innovation and good quality. That's the idea of free market capitalism in a nutshell. However, when I quiz someone in favor of fully privatized healthcare, or calling themselves in favor of free market capitalism, the answer I usually receive is that it's capitalism if it's not owned by the government. Free market capitalism means the government isn't involved and everything's privately owned. While this definition is not accurate, on occasion someone will attempt to support this argument with a basic rationalization about if private insurance companies were less regulated, they could charge less money, or less regulation would mean more people have jobs and can afford private health insurance. But not even once have I been given legitimate financial data to support such arguments as a valid alternative to universal health care. I've consistently been given the drug prohibition fallacy. It makes sense that banning marijuana stops its use, so looking at the data of what actually happens when you ban it is something I'm expected never to do. And it's only a position one can support via remaining ignorant. The arguments given to me have always been based on ignorance, on the presupposition that America has the best healthcare, which is quantifiably false, and that socialized medicine always has worse flaws, that are often also quantifiably false when comparing to the healthcare of other modernized nations. Most of the time, when engaged in a discussion with someone suggesting it be fully privatized, my opponent is unaware of even the most basic information about healthcare in countries outside the United States, as well as the United States itself. People have suggested to me that private American healthcare is cheaper than socialized medicine because that's what they've been told by their politicians in their belief in what they've chosen to label as free market capitalism. They're told outsourcing work to the private sector reduces costs and increases quality, and they never look at the actual financial data to see if that's true or not. I often hear arguments suggesting that private insurance options are exclusive to America's best-in-world healthcare, which is false on both counts. These points are blatantly incorrect, hinge on a person's inability to look at the actual data to know that they're being lied to, and I find it disturbing that I'm presented these arguments with such alarming regularity. When these are pointed out, I'm normally given moral justification as a change of subject to suggest that it's unfair for one person to pay taxes for the medical treatment of another, or that provision of healthcare is unconstitutional. Even if I agreed with the moral position, the financial position's already been entirely abandoned by that point for a topic where a fiscally responsible plan is needed. But let's debunk those positions too. No, universal health care is not unconstitutional. The state has the power to lay and collect taxes to provide for the general welfare of the people. Among general welfare is their health. The state forcing you to purchase from a private, for-profit source, I'd say, is unconstitutional, and I'm fairly certain the Founding Fathers would agree with me. But no, a tax for state health care is not unconstitutional. But as for the point that it's unfair to pay taxes to pay for other people's health care, that's a position that makes no sense given that these same people don't constantly complain to abolish the benefits that they enjoy that are owned by the government or otherwise publicly owned. Benefits such as public roads, public education, fire departments, or the biggest tax-funded benefit they have, the protection of a formal state military. You will never find someone supporting privatized healthcare in the United States on the grounds that they dislike socialism, who will at the same time protest against all the socialized benefits they already enjoy. The profound hypocrisy displayed is not something I have any obligation to humor. When people say they hate socialism and want to get socialism out of the United States, and can actually define what socialism is, and identify what things are socialized and what aren't, I may consider giving such an ideology a listen. But when people protest against government involvement, claiming they hate government programs, while using government programs themselves, while saying they don't use government programs, I have to consider them ignorant and stupid, unless presented a good reason why healthcare should not be socialized, but we should keep public roads, schools, and a military, as all these things, healthcare included, are critical aspects of the nation's infrastructure. The final remaining point that I'm given is that healthcare doesn't count as part of critical infrastructure. I see this point often and usually on religious grounds. This is the camp of people that say that a person's health and life-threatening illnesses aren't important concerns of the state. Upon inspection to whose concern it actually is, I've been given the same answer, that it's the business of a deity. Usually they refer to Jesus, which is funny since he told people to take care of the poor and heal the sick. Even if this were not a direct contradiction, justifying neglecting people medical treatment on the state level on religious grounds isn't allowed under the American Bill of Rights, nor would I allow it under a meritocratic constitution. I've never been presented an argument for privatized healthcare that could withstand even the most basic scrutiny. On occasion, someone will present a point such as, well, if people had to pay taxes for healthcare, it'd cost more, or other similar arguments, but they're drug prohibition arguments. It sounds like banning drugs will stop drug use, therefore you don't need to check the numbers. Come into my used car lot. No, you don't need to check under the hood of one of these cars. This baby runs like a top. You can trust me. As such, I see arguments for privatized healthcare, much like I see arguments in favor of banning marijuana, positions held only by those who are uninformed and expect others to be uninformed as well. I've also spoken to hospital staff and nurses here in the United States, and they've universally told me the same story, that hospitals are often overworked and understaffed. Nurses are managing too many patients and working shifts that are in excess of 10 hours. They're tired, they're sleepy, and they're going to start making mistakes. From what I'm told, the mistakes of a tired person with medical training are worse than those of an untrained but awake and alert person, simply because the mental inhibitions of exhaustion and malnutrition are more significant than the lack of understanding of hired grunts. The explanation I've been given for this state of affairs is that the hospitals, being businesses, are concerned with making money, not with the health of their patients, and that this is leading them to cut corners, have less staff where more is needed, and simply accepting that the inefficiencies will lead to people getting killed in the interest of profit. I've also been told that if doctors could cut out the middleman of having to work for a for-profit industry and could be paid more themselves instead, that might make their career more worthwhile. Now, from the left, usually the argument in favor of universal health care that I come across is on moral grounds, though I've also seen it on financial grounds many times. Still, like the conservatives, they don't seem to push for educational reform or upgrades to train doctors faster or for doctors to be paid more. It's been expressed to me that some doctors feel they could have got through med school faster and were arbitrarily slowed. I've also been told that some feel that had they worked in a different field, such as computer science, they'd have got out of school faster and been making more money. Neither side, conservative with privatized healthcare nor liberal with state healthcare, seems to want to address these issues. I've yet to hear a single argument in favor of either position to point out, let alone present a solution for, the lacking availability of trained medical personnel faced by the United States. If the information I've collected reflects the majority accurately, and I'd like to find a poll of doctors to find out if this is indeed the case or not to further support my point, then neither universal healthcare nor privatized healthcare will be a valid solution to America's problems. Privatized because there's not remotely enough competition for it, and universal because rationed healthcare only works if there's enough rations to go around. That said, my list of criticisms for those supporting universal healthcare is pretty much limited to there being less attention for educational reform and job enrichment than I'd like, and sometimes the lack of a discernible path with which to realistically bring universal healthcare about in this country. Minor criticisms in comparison to those in favor of privatized healthcare, as the fiscal data shown to me is consistently vastly superior to anything conservatives have ever shown me. I don't think a fully privatized model is capable of working short of development of technology to download data and memories into people's brains, or some sort of cultural shift that makes the various medical treatments much more available than they are already, given how specialized medical fields can be and how long it takes to train people to fill specialized roles. Now, in the United States, the earliest implementation of universal healthcare we could see is the inclusion of a government-run insurance company, commonly referred to as a public option, which would exist to force the private insurance companies to charge more fair rates in order to compete and remain in business, thus breaking the stagnated monopoly that ignorant people mislabel as free market capitalism, and actually inject some competition into the mix. This would be something providable that wouldn't require us to regulate or otherwise interfere with the businesses of the insurance companies, and instead of regulating them, simply force them to compete. This option would appeal to most people claiming they support capitalism if they had any idea what capitalism was. It's not universal healthcare, but it's an easy-to-implement step in the right direction to stop people from paying out the nose to get third-world quality, half-rate medical coverage that puts the USA to shame compared to any other modernized nation. It's not really universal healthcare, but it's a quick band-aid fix to hold the problem down until I could finish implementing a more permanent solution. More on that in the meritocratic healthcare video. Like this video and share it to make that video more of a priority, and subscribe to my channel.